I check the order prior to entering the room, which says to apply a light dressing with normal saline irrigation. Open the door, close the door to provide privacy. Hi there, my name's Ashley and I'm a student. I'm just here to change your dressing. Can I get your first and last name?
Drew Vineyard.
And your date of birth?
May 8th, 2001.
Awesome, and can I just check that on your wristband? Perfect, thank you so much. So I'm just gonna do some hand hygiene here. So do you have any allergies?
No.
Before I start? No latex, iodine,
No.
tape, antibiotics? Nope? Okay, perfect. So what I'm gonna do is I'm gonna remove your old dressing, I'm gonna clean your wound, and then I'm gonna apply a new one. Is that okay?
Yep.
Perfect. And before we start, do you have any pain?
No.
Perfect, so we'll get started. I ensured that the patient was comfortable and I exposed only the wound site, so I'm gonna go ahead and clean my space. I'm going to gather the necessary equipment for the procedure, and I'm going to begin to set up my sterile field. So I'm going to open the dressing tray away from me, grab the forceps, and grab the first pad, always ensuring to stay within that 1-inch border. And I'm going to place it on the table, shiny side down. And then I'm going to grab the second pad, ensuring to stay within that 1-inch border, and I'm going to place it underneath the patient. And then I'm going to grab the garbage bag and place it beside the patient for easy access. Then I'm going to continue setting up the sterile field. I'm going to grab the forceps and place them within the 1-inch border. And then I'm going to grab the gauze and drop it from about 6 inches. I'm making sure to not cross my sterile field at any point. So now I'm going to prepare the normal saline solution. For the purposes of the video, I'm not actually going to pour off or pour out any of the solution, but now is where I would remove the top and pour off into the garbage. And then, making sure not to cross the sterile field, I will pour some into the dressing tray. Now I will don a pair of clean gloves. So now I'm going to remove the old dressing, pulling the tape towards the wound. I will assess the drainage. I see a small amount of serous fluid. It's clear, thin, and watery. I'll dispose of the old dressing, and I will assess the wound. There's no redness or swelling around the wound. It is a surgical wound. So now I'm going to go ahead and irrigate the wound. But first, I'm going to don clean gloves. So I'm irrigating the wound. And now I'm going to grab my forceps and clean the wound with the gauze. I'll dip it. And then I will start directly on the wound and dispose. And then I will swipe farther away from me on the opposite side of the wound. And then the side closest to me. And again, on the far side, a little higher up, and then I will grab another gauze, dip, and clean. So now that I've cleaned the wound, I'm going to measure the wound and assess for any necrotic tissue, which there is none because there is not really a wound bed since it's a surgical wound. So the wound is about 8 centimeters long. There is no odor or exudate present with this wound, so now I'm going to go ahead and start applying the new dressing. So I'm going to grab my forceps that are within the 1-inch border, and I'm going to grab the gauze, and I'm going to carefully place it on top of the wound. I'm going to grab a second piece of gauze just to ensure that the entire wound is covered. And now I'm going to grab my abdominal pad and open it from 6 inches above and let it drop into the margins of the sterile field. Now I'm going to grab my forceps and grab the abdominal pad and place it on top of the gauze that I just placed. Now I'm going to tape around the edges of the abdominal pad to ensure that it stays on the patient. And I'm going to ensure that one piece has the time, the date, and my initials on it for any future dressing changes. So now I'm going to dispose of my equipment and clean the area. Now I'm going to perform hand hygiene, and I've wiped down my area and all the equipment that I use that is reusable. I'm going to ensure that the patient is comfortable in the position that they are in, or if they would like me to adjust the bed, make sure the call bell is in reach, ask if there's anything else that they need, and then I will leave the room and chart my findings.